Hello, everybody. So tonight's topic is one which should be vitally important to everybody. In fact, it's one of the things that keeps us all alive, which is our hearts. So, heart disease, as you might know, is the #1 killer of Americans, even women as well as men. People think that the estrogen does help protect women up through a little bit later in life, but after they go through menopause, the rates of heart disease also climb up in women as well. Not too long ago, I had the distinct pleasure of being able to go up to Cleveland Clinic and meet with a good Dr. Esselstyn, who is the author of this famous book. Can't really see it too well in the backwards, but if you were able to read in a mirror, it would say Prevent and Reverse Heart Disease by Caldwell Esselstyn Jr., MD. And he was one of the people that basically did some groundbreaking work and found the principle of being able to reverse heart disease through diet alone. Now, a few people had been working on that same topic previously, for example, Dr. Pritikin back in the 1970s, whose work was even further made famous recently by one of my favorite doctors, Dr. Greger of How Not to Die fame. Dr. Greger, of course, runs the nutritionfacts.org website, which is amazingly full of groundbreaking reviews of the latest literature in food and health. And the very first chapter on this, in fact, is How Not to Die of Heart Disease. And he gives a story of his grandmother who basically in the 1980s was diagnosed with heart disease. She had bypass after bypass and finally was essentially sent home to die in her rocking chair. And she discovered Dr. Pritikin through the 60 Minutes program that he did once and went all the way out, I think it was California, and within a few weeks was climbing mountains essentially and going from being wheelchair bound to being able to walk, which was part of the inspiration for my favorite doctor to go ahead and dive into the literature to help share a lot of these groundbreaking ideas with the general public as well as other physicians who sometimes are a little bit resistant to new ideas. As a matter of fact, you might remember that hand washing took, I think over a century before it became common practice. And yeah, I'll let that one sit for a minute. But basically, there's very few ideas in medicine that actually gain popularity and that actually quickly gain acceptance in the medical community. And there's some good reason for that, because people don't want to be jumping in every new little thing that comes out until there's some proven benefit to it. But on the other hand, it also is kind of like turning a giant freight liner as opposed to turning like a little tiny Coast Guard boat or something like that. It just takes a lot more momentum to start to incorporate some of these ideas into the hearts and minds of the cardiologists, the other physicians, and so forth as well. So anyway, I like to be on the frontier edge, and so seeing some of the people that I know benefiting from this is amazing as well. Dr. Ornish is the other gentleman that deserves special mention. His book, Dr. Dean Ornish's program for reversing heart disease, the only system scientifically proven to reverse heart disease without drugs or surgery. His program, in fact, is so well recognized now that insurance companies are paying for his program. Part of the difference between his and Dr. Caldwell Esselstyn's is Dr. Esselstyn shows, hey, even without using exercise and relaxation and other kinds of techniques, just the food alone is sufficient to be able to reverse heart disease, whereas Dr. Ornish's program is a little bit more comprehensive, involving stress and meditation, relaxation training, exercise coaching, relationships, stress relief, as well as food and so forth. So he's got a little bit more of a multi-dimensional approach as far as being able to help people get on their feet a little more quickly. And so Yeah, so it was wonderful to be able to see Dr. Esselstyn again. I've met him a few times at some of these international plant-based medicine conferences, first of which that I went to was in 2012, the inaugural on there. In fact, that conference is going on this week. So for those who are interested, check out the plant-based medicine conference. I'll put the link down in the comment section after we finish up in case you're curious. They're actually live streaming it this week as well. Hopefully they'll have it available for See Me at some point later, maybe. Alrighty, so what can we do to prevent and reverse heart disease? So the diet patterns that people adopt to reverse heart disease are possibly a little bit different than can be used to prevent it in the first place. Now, part of the reason why I say that is when I have spoken directly with Dr. Greger and Dr. Esselstyn and Dr. Ornish, all three of them, some of the big names in this a couple of years ago, I was wondering, all right, well, there's a lot of research on nuts, for example, and their role in preventing heart disease, which we'll cover in a moment. And essentially, Dr. Greger, I think, put it best. When somebody already has known heart disease, we simply don't have any research comparing a whole food plant-based no added oil diet to a whole food plant-based no added oil diet plus a handful of nuts every day of various kinds. And so until such studies are actually done comparing some of the finer points of some of these features, we really don't have the evidence behind it to be able to say for sure what some of these things are doing. When I asked Dr. Ornish about it, because there was a lot of new research being underdone about the people that are having nuts in their diet having less rates of heart disease, he was actually considering moving the nuts from a red light to more of a yellow light food, meaning that in the stoplight system, green is full on go. Basically, for example, eat all the greens you want and no problems, all the fruits, the whole vegetables, and so forth. Yellow light was like maybe a little, once in a while you can delve into some of those foods without lasting impact, and then red light was please stay away from these foods altogether. So he was considering moving it from a red light to a yellow at that time. That was a couple years ago. Have not had the chance to ask him about it since then. So anyway, so these kinds of things, the realm of the heart disease is always being investigated and always new things are coming out. So of course stay tuned, and stay tuned on Dr. Greger's website for the latest. So one of the things that we look at a lot with regards to people's risk for heart disease is something called the Framingham Risk Score. And again, another thing I'll put in the comment section, because this is something that I found to be a vital tool in helping people understand their own personal risk. So the idea there is you take some very common metrics about the body. In other words, like your blood pressure and your cholesterol numbers, and whether or not you use tobacco. Tobacco is terrible for the arteries and the veins, by the way. Please, if you're not off of tobacco yet, please find some way of getting off of it. Very important. Anyway, so the metrics for that, the various little things that you're doing that you have for your blood work, kind of get plugged and played into this algorithm that was originally done in a town that's not too far from my hometown, Framingham, Massachusetts, and that was chosen because it has a wide diversity of peoples and nationalities and all sorts of things up there. And basically it tells you what your risk is for heart disease over the next 10 years. And I found that to be a very, or an effective motivating factor for people who don't really realize how it affects them personally, because a lot of people think, I exercise, I lift weights, I go to the gym, I eat healthy, which for a lot of people means I eat chicken and fish and I don't eat a lot of beef or something like that, which doesn't necessarily protect you against heart disease, as the research is turning out to show. Anyway, but that's what our culture says is healthy, and so they feel like I have stuff in moderation, and you know, a lot of these common cultural myths of what actually entails that does not equal the kind of foods that actually reverse heart disease and reverse diabetes and reverse blood pressure problems and so forth, which is why we have a country of millions of people on statin drugs, cholesterol-lowering drugs, and getting all the side effects of various kinds of prescriptions for a preventable food-based illness, essentially. Even children as young as 10 years old are starting to get fatty streaks. And even more scary, some of the infants, even before they're born, there was a study on women that had miscarriages, or for some other reason the infant was basically died before came out. And on some of the women that had the high cholesterol numbers, or that were very overweight or obese, those infants were also getting those fatty streaks even before they were born in our today's culture, which is mind-blowing. And if you're curious about the research, I'll have that linked below too, just so you can see for yourself. It is absolutely mind-blowing to think that even before these kids are being born, which is one of the reasons why we're talking about this current generation for the first time in decades having a lower life expectancy than the preceding generations. Some of these lifestyle factors kind of setting back these years of progress. Anyway, so when people know their Framingham risk score, they get a sense for what is their personal risk of heart disease, because one, the numbers really don't lie. It's a kind of a population-based thing. But two, you can play with the numbers a little bit and say, all right, so what if I'm a 49-year-old male with a total cholesterol of 250, LDL cholesterol, the bad cholesterol as we call it, of, like 180, and HDL, the good cholesterol, of 25, because they don't work out. And you can really easily see that, for example, if they use any form of tobacco, and for this purpose I include the vapes, I include the chewing tobacco, I include the cigarettes and the cigars and all of that kind of stuff, even if it's only once a year. Yes, I am talking to you part-time smokers as well, because even one drag a year is incredibly damaging to the arteries. You have no idea how crunchy the arteries get. I've played with cadavers. I know they're extremely... the arteries are like eggshells on the inside when people have been using tobacco, and when they have this hardening of the arteries, it really honestly is hardening of the arteries. It's kind of an incredible thing to experience in medical school. So being able to play with these numbers, you can see what the effect of using tobacco or not using tobacco is. And sometimes I've had people with a 25% risk or a 30% risk of having a heart attack in the next 10 years, and you just simply unclick the tobacco box, and something like, say, 28% risk drops down to like 18%, or drops down to 10% risk. And you can change the age and say, all right, if I keep this pattern up 10 years from now, oh shoot, I'm like set to have heart disease in the next 10 years. Essentially, I presume that every male in this country above the age of 20 has some degree of heart disease already, if they've been exposed to our standard American diet, because it is so darn artery hardening. Even the foods that are labeled trans fat free, for example, legally, as long as it's less than, I think it's like 0.5 grams, don't quote me exactly on that, per serving, they're allowed to call it 0 grams, and that's one of the most artery hardening, destroying types of fats that are out there. Anywho, basically, I talk a little bit about heart disease being a plant-based or a preventable condition, because there are cultures and populations around the world that have a naturally plant-based, whole food, no added oil kind of diet pattern, because, for example, in various parts of Asia, for example, they don't have olive trees naturally growing in certain areas, so they're not, getting olive oil and other kinds of oils. And also the food that you grow is the food that's most easily available, obviously fresher and other things too. In the Korean War, back in the day, they used to do a lot more autopsies than they do today, and the young American GI soldiers that were being killed, again, they were finding already the beginning traces of heart disease, and that was, that was quite a few years ago that this was happening, even before all these extra layers of chemicals and additives and all sorts of things in our environment have piled up. Whereas the young Koreans that they did the autopsies on, their arteries were squeaky clean. And what was the difference? Basically, where they were born and what kind of diet they'd been exposed to since early childhood is the main thing that's made a difference. And of course, when these giants in the field were looking at these kind of population-based studies around the world, they were saying, wait a second, these people in these rural communities, rural Africa, rural China, and so forth, they're not experiencing the major killers that we were having in America and other Western civilized, as they like to say in the old days, countries. And what would happen if we took people from those countries and gave them a Western style diet, and people from our Western style countries and gave them the whole food plant-based diet pattern, and they actually found that the risks for heart disease interchanged. So when people move to America from some of these areas and change their diet to our diet, guess what? They start to get our diseases too, and vice versa. I've actually got a couple of friends that have been able to successfully reverse their heart disease in ways that you can actually measure through this diet pattern as early as a few months out, which is actually pretty amazing. Yeah, think about it. So anyway, more to come on that. Dr. Resselson famously tells his patients, you can either give 5 hours of time to a cardiac surgeon and have them slice you open and take your veins and basically rearrange everything in here for that heart graft of the blood vessels, only to fail a few years later, which unfortunately does often happen, especially if the diet and lifestyle pattern that caused you to get that heart disease in the first place has not changed. Well, basically throw in there a vein that's not used to all that pressure of being in an artery position. For those that don't know, the heart, when it beats, it puts a lot more pressure on that initial set of blood vessels, which is kind of designed to be able to handle that level of pressure and stress. Whereas the veins are kind of returning the blood to the heart, and so they're designed for a much lower stress pattern in general. And so if anybody's considering heart bypass surgery, please, obviously, if it's not an emergent case or something, talk to the cardiac surgeon, and just also make sure you know what is the risk of this failing after 5 years, after 10 years. And you'll see that there's many patients that unfortunately have had to have 3, 4, 5, well, 5 is kind of pushing it, that's not very many blood vessels left to be able to bypass when you get to that number. But how often is it that these stents and bypasses fail? And that just so that if you're going into something, you have all the information at your fingertips. But anyway, Dr. Esselson says you can give the thoracic surgeon 5 hours or more of your time, or you come to Cleveland Clinic and give me 5 hours of your time, and I'll teach you how to basically reopen those blood vessels. And it is a very moving statement, but it is also something that I've seen in my clinic and also in my personal friends as well, which is very touching. So anyway, I will leave you guys with those stories just for this introduction segment, and some of those links so you can kind of check out what's your Framingham risk score and so forth, and get a sense for it. I want to do a second one talking just briefly about specific foods that are especially good for including into your whole food plant-based no oils diet as well, to especially make those arteries shine as well. All right, thanks for tuning in. More to come in just a minute. Thank you.